at the bottom about, we'll talk about a little bit later, that RDs impact the bottom line and we save a lot of money. So, okay, first of all, like, why is a dietitian important? Like, what is a dietitian? I think a lot of people have questions about this. When they find out that I'm a dietitian, a lot of people will ask, so what exactly do you do? And legislators are going to have the same kind of questions, like, what is a registered dietitian? We want to help them understand that we are the experts in nutrition, and we definitely want to let them know about our organization. So New Mexico's Academy of Nutrition and Dietetics. When there are public policy issues that come up related to nutrition, we want them to contact us and get in touch with us when they're making those policy decisions. So the more that they get familiar with who we are and how to contact us, the better. We want them to understand about the importance of licensure. We're licensed in New Mexico. That's part of our credentialing through our licensing board. And that we're required to keep up with continuing education requirements and stay up to date. Okay, so we're going to talk, our objectives for today's webinar are really clear. We just want to review the key legislative day objectives, which we did a little bit, and we want to create an elevator pitch, which is what we're going to do now. So an elevator pitch is pretty much just that. If you were in an elevator with somebody and you had a limited amount of time to get your point across, what are the key messages that you would say? So it's basically a short and a relevant speech. So for us on Legislative Day, we want to answer, who are we? What do we do, related to nutrition? And why are we, as dietitians, the experts in nutrition? And keep in mind that we are perfectly positioned to achieve desirable nutrition outcomes in New Mexico. When you develop an elevator pitch, the legislator is not the only one who would benefit from it. So if we take a little bit of time today, we're going to that we can clearly convey our important points to people that we work with or with friends. I have nurses ask me a lot about what dietitians do for credentialing, what our education is. They're a little confused. What's the difference between a dietitian and a nutritionist? So I think the more we can clarify these things, an elevator pitch is something we could use to legislators, but they're not the only ones that are curious with it, and that helps as well when we talk about it with other people. One thing I wanted to say is the more dietitians that we can get at Legislative Day, the better. Dietetics by nature is a really broad field, and we do a lot of different things. We work with a lot of different populations. We have different goals. We speak with one voice. We share the Academy's position, but we have different stories to tell, and that diversity makes our message even stronger. So when we start building our pitch, this slide is pretty simple. It doesn't take a lot of thought. You want to introduce yourself, tell them who you are. If you have a computer or a piece of paper and a pen, we can start drafting this out today. So when it comes to Legislative Day, you're already partway there. You already have stuff written. It makes it a lot easier. So when you introduce yourself, you want to give your name and your title, your credentials. You're an RD already. Maybe you're a dietetic student. Maybe you're an intern. And where are you from? If you're from New Mexico, if you live here, you want to let them know that you are a constituent in their voting district because they especially want to hear from you. They want to know where you work, what is it exactly that you do, and you can decide to keep that broad or specific, whatever you think is best. So clinical dietitian, or are you a pediatric dietitian at Loveless? If you're a student, maybe what you hope to do when you graduate, or what you're studying, what interests you the most, concerns that you would like to address. And then we want to keep bringing up NMA&D, include that you're a member of that organization. So just, again, to make sure that we're the go-to organization for any other questions or concerns that are related to nutrition. Okay, so what do we do? The main reason why we're going to be at Legislative Day is to educate them about the importance of dietitians. And so a lot of us, like I said, can do that a lot better than any one of us alone, just because our stories help to give a broader perspective of dietetics and make the point a lot more clear. I think some of these things we'll need to take a little bit more time to think about. It's not as easy as just what's your name and what are your credentials. There's a lot of possible answers we could use, like we protect the public from incorrect and even harmful nutrition advice. That's a big benefit of licensure. We provide evidence-based nutrition, based on scientific research. We've completed supervised practice and accredited internships. We have a lot to offer for the nutrition problems in our communities. But if we can enunciate why that message is important by the stories that we share, like how have we personally made a difference in our profession and in our career. So we want to make a personal connection to the issue. What is the population that we work with? What are the concerns that they face, and how do we help them? And if you have any specific stories to tell of success or harm, I recommend actually if you have jot them down. You might have many stories to tell, and if you don't write them down, you probably forget them. So even if you keep a notebook and just talk about, just keep track of the stories that are there. When it comes time for Legislative Day, you have a lot of examples or stories to pull from that can really add a lot of clarity to your pitch. It all comes back to these two main points. Remember the importance of a registered dietitian and the importance of licensure. And the stories are really important, but we want to back that up with the numbers. We want to look at the outcomes. What do the outcomes say about what we do? How does it say that the people that we serve are actually better off?
About you.
Legislators are going to need proof that what we are advocating for is in fact effective and that it's good for the public. So we're going to look at a few statistics today, but when you come on Legislative Day, we will actually give you a packet to leave with the legislator, and that packet will have updated information and statistics for them. So these figures today are an example of data that's available on RDs and how we are effective, but it's not something that you need to memorize. You want to make sure that we personalize the issue for the legislator. Maybe they know somebody who's impacted by nutrition. Everybody does. And how could that person have been helped by a dietitian? So kind of engaging them and trying to find out where their interests lie is really helpful. And then the bottom line, politics is very heavily influenced, like so many things, by money, and we want to point out that what we do is good, but that it also, not only does it not cost money, but we actually save them money. So we can help. In August 2013, the CDC reported that New Mexico obesity rates fell among low-income children ages 2 to 4 who participated in federally funded maternal and child nutrition programs such as WIC. So this is helpful, just showing that those that participate do have better outcomes, but you'll notice that the decline was just less than 1%, so there's still a lot of work to be done. And then in 2012, these are the New Mexico Department of Health obesity rates, 14.6% of kindergarten students and 21.4% of third grade students. So those are really high, disturbing numbers, and we want to show that programs that we can engage them in programs that can help cut back on this problem. So just for example, like with the money, and like we said, there will be a lot of other statistics available on Legislative Day, but obesity attributable expenditures in New Mexico were estimated at $663 million a year. This was actually in 2011. 42.5% is financed through Medicare and Medicaid. And then MNT provided by RDs can reduce healthcare dollars by at least $350 per patient annually for obese patients with type 2 diabetes. And that's actually from 2004. So we're going to try and get the latest data that we have for Legislative Day. But the point is still the same, that they are showing, there are studies that are being done and that show that the interventions, the MNT, specific things that we are doing save the government money, which is great. Okay. Just in terms of writing an elevator speech, just a few things that we want to keep in mind. The most important is to just be yourself. So we want to be memorable and we want to be informative. At the top it says Pith. So we want to develop Pith. Pith is basically the essential part of your message or the core of your message. So if it's, we might be tempted to bring up a lot of extra details, but we want to keep in mind what is the essential points of our message, what is it that we want to convey. We want to stick to that core message and keep our language simple and understandable. I think sometimes as dietitians, we work so much with nutrition that we say things that we think everybody understands, and then it's sort of surprising to us when they need a little bit of clarification. So it doesn't hurt to practice with somebody who might not be a dietitian. If you write out your message and say it to somebody and ask them if they have any questions or if what you've said has helped answer their concerns. You don't want to say too much. If it's extra details, you want to cut it out, but you want to make sure that you don't say too little either. I think we talked a little bit about stories that we can share, and I think sometimes we find those to be extra details. People don't really want to hear my little story or my experience. It's not really that interesting, but that actually personalizes the message a lot for the legislator, for whoever you're talking to. It gives a case study to what you're talking about. So I would say that's something that you would not want to cut out because it does bring clarity to your message. So you want to make sure to always maintain clarity over brevity. You want it to be short and essential, but not too short. You want to say enough, say what you need to say, and put in the data and statistics to back it up. Also, just wanted to say about we talked a little bit about the numbers, like how we've been shown to be effective and how we save people money. It's good on Legislative Day we'll have a packet of information that you actually leave with the legislator. So it's good to actually open up the packet and point out some of those statistics to them, and you can just read through it with them. So that helps them recognize what information you've given them, and then they can go back and look at it later. So none of that is stuff that you need. Like when you show up on Legislative Day, you don't need to feel like you have a bunch of facts and figures memorized or some big pitch that is, memorized and rote and repetition. You can definitely personalize your message and engage with them, talk with them. Just make sure that you're prepared so that when things come up, you're ready to address them. In terms of the delivery, I think people get a little bit nervous about talking with legislators. They are people, and they do this a lot, so I'm sure they meet a lot of people that are really nervous. It gets easier with time, but it does help a lot. Look them in the eye, which shows confidence. Be confident, smile, be natural, be yourself. If you do practice talking a little bit, like if you give any kind of talks or presentations for school or for work, and you're nervous about them, it can help to practice in front of the mirror because you can look at your body language, what you're saying. I think we pay a lot of attention to the message that we're giving and not as much to how we give it. But the hand gestures can be really helpful. So if you use natural hand gestures, that can actually enhance your message. It can make it seem more natural, not so stiff. But you want to make sure that it's not detracting from your message. Sometimes your body language might show that you're nervous or might make you look overconfident. So if you practice a little bit in the mirror and look at how does this look when I give this presentation to somebody? That can be really helpful. Then just points for success. Be yourself, be genuine, be concise, be memorable, and most of all, be respectful. Whether you agree with their political positions or not, we are not there to debate with them or argue with them. We just want to educate them on the importance of dietitians and the importance of licensure. So we want to make sure that we are always respectful and positive. Avoid giving personal nutrition advice as much as possible. I think everyone who's involved in nutrition has that experience. What do you do for a living? And then people have a huge list of nutrition questions they want to ask you, or like, oh, can you help me lose weight? Or I have a sister who has diabetes. It's not really our purpose up there to give them nutritional advice. You can find a tactful way to bring it back to the issue, but not turn it into a counseling session. Avoid political partisan discussions. We don't need to get involved in issues with them, other interests. In Santa Fe, we represent the Academy for New Mexico, and we want to make sure that what we say and what we do is in line with their position, and stick with that. So, and then just in the end, we want to always thank them. Thank them for their time. Always be courteous, even if you disagree. Leave information, including an MA&D business card, and point it out to them. So, again, we just want them to come to us with their nutrition questions or policy concerns. And so we want to make sure that they know how to contact us. It's easier to contact somebody when you have their number. You know who they are. You've seen their face. You know what to expect when you ask them questions. So we want to build that rapport and that relationship with them so that they will come to us as well. And then report any requests if they want more information on something that you've talked about, or any resources. We want to get those to them. So after you talk to legislators, we will have you report back just how the discussion went and if there's anything that we can do to follow up. But we want to make sure that we definitely follow through with any of those requests. So we thought maybe we could give an example of what an elevator pitch might sound like to a legislator. And I think it's good that we all have different ways of communicating our points. I think that's helpful. But Kristen is on the phone today. She's talked a lot with different legislators. And Kristen, do you mind sharing with us, what would be an effective pitch with a legislator?
Sure. Can everyone hear me?
Yes.
Yeah. All right. So I'll just take you through a quick couple examples from my experience at the past couple legislative days to give you an example of how I spoke to them and kind of let you see how easy it is to speak to a legislator. Legislators in New Mexico, our legislation is a volunteer legislation, which means that the people that run for office do so on their own time. They're not paid for their job. They do get some money during the legislative session, which in New Mexico, we have alternating years. So every other year, including this year, we have a short 30-day session where the session really focuses on the budget. And then in the other year, so next year and every other year after that, we have a long session, so 60-day session, where a lot more legislation is open and there's a little bit more flexibility. So these people really volunteer a lot of their time. Most of them run for office because they're passionate about something or feel a duty to their some kind of civic duty or something. And of course, I don't know the motivations of every legislator. I'm not even pretending to know that. But in general, most people in our legislation, they have other full-time jobs. They have other, duties and they're responsible for all the legislation that comes through New Mexico. So when you're speaking to them, remember that they're not an expert on many things. So they're always interested to learn, and they look to us as a resource, and they welcome the interaction so we can educate them on issues. They almost expect that from their constituents. The other thing I would say is that, I lost my train of thought. So I'm sure it'll come back to me. So let me take you through an example. The very first legislator that I targeted as state policy representative was someone called Senator Dee Feldman. And she's no longer with the New Mexico legislation. She's retired. She was a senator for a very long time. I don't have her credentials in front of me, but I think at least 11 years she was a senator in New Mexico. And she championed a lot of legislation that had to do with healthcare reform, women's rights. She sponsored a piece of legislation that named an ARCA day in the legislature, which is a place that I personally work as a dietitian. So I thought that she would be a great contact and a great person to meet. And so I kind of put her on my list of people that I would like to speak to the first year. I just got the packet of information. I went up to her office, which will help you with all of that information, where to go, who you might want to target, and how to find them. And we'll give you the information to deliver. And I just went up to her aide and basically said, I'm interested in speaking with Senator Feldman today. She was quite busy in the morning. She was in and out of committee meetings, and so she wasn't available during the morning, but in the afternoon she was going down to the general session. And I left my card along with my cell phone number, and she said she would call me if the senator had a minute, which did happen. The senator only had a few minutes, and I basically walked her from one meeting to the next. Literally, I just met her around her office and walked her and talked to her, give her my elevator speech on the way from her office to her next meeting. So here's a little bit about how that sounded. And I'm not an actor or anything, just so forgive me. I met her in the hallway and I was like, "Hi, Senator Feldman. My name's Kristen Crosby. I'm a dietitian in New Mexico, and I wondered if you had a few minutes to speak to me." And of course she said, "Sure, I'd love to. I'm on my way to a meeting." And I said, "No problem. Do you mind if I walk you to your meeting?" She said, "No problem. I think it's important that you always ask that it's okay that you speak with them, because they're very busy people, so you want to be polite." And I said, "Thanks." So we started walking, and I just, I asked her, I was like, "Senator Feldman, are you aware of what a dietitian is, or have you ever interacted with a registered dietitian?" She was aware of what a dietitian was, and so that was easy. But I think, when it comes to that can be your first question. And anybody I know we have a lot of dietetic interns on the call today, and other professionals. And I think all of us have had to explain what a dietitian is to somebody. It's not a nurse. It's not a doctor. It's not somebody who is highly recognizable when it comes to just the name dietitian. So that should be an easy conversation for all of us, should you ever encounter that. She did know what a dietitian was, so we just moved forward. And I said, "Well, I'm glad you know what a dietitian is. We're science-based professionals. We have a science education background. You have to have a minimum of a bachelor's degree before you're even welcome to enter an internship, where it's a year of supervised practice, or basically like a residency." That's how I like to describe our internship. And on top of that, we're accredited professionals. We're board certified, or we have to sit for a registration exam nationally to be able to practice clinical nutrition. And on top of that, we're also credentialed by the state. We have licensure here in the state. I think dietitians can be very effective. And I know, Senator Feldman, that you've championed a lot of healthcare, legislation over the years. And I just wanted to introduce myself so I could be a contact in the future. Should you have a piece of healthcare legislation, I want you to think, of dietitians possibly being included in that. We use evidence-based recommendations. So compared to other professionals that may want to give nutrition information, we make sure that the recommendations that we give people for their health as far as food and nutrition does come from evidence-based research. So that's a quick elevator speech that maybe I possibly was talking for about a minute. Sometimes that's all they have to give you. Usually they have a little bit more time, so you can continue. Any questions about the first part?
I do have one question. My name is Amanda Escobel, so thank you for being here with us today. But if you did have someone who didn't know what an RD was, what is the most effective way to explain what we do and what we are to someone who has absolutely no clue of what we do?
So have you ever explained that? So Amanda, tell me a little bit more about yourself.
I am a dietetic intern at New Mexico State University, and I've explained it, but I never know if I'm explaining it correctly. So I just want to make sure that when we do explain it, it's correct.
So something that we use in our messaging that we'll have prepared for you is I like the word the food and nutrition professionals. You know, as dietitians, we are professionals, we are licensed, we are accredited. So that's kind of the tagline that I like to say. And, you know, as Janae was explaining, you want your message to be simple, you want it to be concise, and you want it to be a little bit memorable. So things like looking them in the eye and having a personal story. So if someone asked me what a dietitian was and they didn't know, I would say, you know, we're the food and nutrition professionals. I think that's quick and concise. You can talk about part of the allied health team possibly. You know, there's a lot of allied health professionals on any healthcare team, and when it comes to food and nutrition, dietitians are the ones that are poised, not only because of our education, but because we use evidence-based research and recommendations, we're poised to help people with any food and nutrition question. For example, people with diabetes possibly you may want to bring up. Anybody with diabetes may have lots of questions to how to control their diabetes or prevent diabetes just using the food that they eat. And that's what dietitians do. We help people with chronic disease management and or just health promotion through the food that they eat. So food and nutrition professional is the way that I would start the conversation.
Okay, thank you.
You're welcome. Great question, Amanda. Anybody else have any questions?
It's good just to throw on there, too, like you could add an I, for example, do. So you can generally talk about, you know, what dietitians do, which is helpful. That's what they need to know. But if you can use an example like, you know, I work every day with people who, you know, and this is, you know, these are the outcomes that I've been able to achieve with them, that's really helpful because they're talking to somebody who has actually done this and done these outcomes, and then you become this resource that they can ask specific things to because they know what you do. Okay.
Yeah, so after giving myself a quick introduction to Senator Feldman, the next thing I moved on to is why I think that she should call me, basically, whenever, or include dietitians and use the academy as a resource should, you know, any kind of healthcare legislation come about, particularly licensure coming up in the next few years. So I introduced myself to Senator Feldman, explained why I think dietitians are important, and then I moved on. At the time, we were still at the beginning stages of the Affordable Care Act, and I thought Senator Feldman would be poised to be the sponsor for a lot of different legislation that may come about in New Mexico in relation to the Affordable Care Act. So the next message I gave her was I wanted to give her information about how dietitians save healthcare dollars. And just so you know, Amanda, we do have a handout on what a dietitian is and why we are the food and nutrition professionals. So it talks about a little bit where dietitians work, that we work in schools, we work in healthcare, we work in hospitals, anywhere that you would find any other kind of health professional, you should find a dietitian as well. We talk about, dietitians work for industry and things like that. And so I handed her that handout during that first conversation. And then moving on to the second part of the conversation, I wanted her to understand why I think dietitians should be included in healthcare legislation. So the conversation maybe went something like this. So Senator, I wanted to talk to you today because I know that you champion a lot of legislation in New Mexico in relation to healthcare in particular, and I might have named a couple things that I had in front of me at the time that she had sponsored that I felt were really important legislation. Or perhaps you know something about them that they're currently sponsoring now that you may want to speak about. And so I gave her another handout, and I just said, this handout speaks a little bit about why dietitians are important to be included. In this day and age, we are looking for ways to cut money. Both our state budget is in crisis and the federal budget, people are always looking way to save money. And when it comes to the Affordable Care Act, that's really the main point, as you well know. This piece of paper just talks a little bit about some research on how dietitians save healthcare dollars. And particularly when people see a dietitian in relation to obesity and or diabetes, we can help them prevent weight gain or weight loss. Dietitians are quite effective in helping people prevent the progression from prediabetes to diabetes. So you can see how important it would be to make sure that any legislation that's introduced includes the dietitian. In particular, I know that there may be legislation coming up about the essential benefits package, which, as a side, for those of you who may not know, with the insurance exchange or healthcare insurance exchange that people are now, the website that everyone talks about federally, people getting signed up for insurance, or we have our own New Mexico exchange where anyone can go to shop for insurance outside of an employer plan or other options for insurance. And there's something called an essential benefits package, which means that every insurance that's on that exchange has to provide essential benefits. So that's what I was speaking to her about. So moving back into the conversation, I said, I know that you may be involved in some of the legislation that's coming about the essential benefits package. And I think it'd be great that dietitians were included, in particular, making sure people are eligible to see a dietitian for different things like weight loss or, yada, yada, yada. You could talk about all kinds of different things. And of course, that's something in the past. But that's a quick example of, tying some legislation that may be upcoming and the reason that I really wanted to speak to her. And of course, I had a handout ready for that. So the message is, as Janae mentioned, that we'll be asking you to speak to legislators this coming legislative day, is what a dietitian is, why we save healthcare dollars, and most importantly, why licensed professionals are important, because as everyone, or hopefully most people know by now, our licensure in New Mexico will sunset or cease to exist in a few years. And so we'll be working very hard to introduce another bill in the coming years to make sure and preserve our licensure.
Thank you, Kristen. That was very helpful. I don't know if anybody had any other questions that they wanted to ask. I think the key points that to remember from today is definitely the date, that Legislative Day is January 24th, which is a Friday, and that we are the experts in nutrition, and realize that you do have a story to tell. So we'll help get you ready as much as possible about what the message is, what we want to say, and then just think about your own experience. And, when people ask you questions at work, or when people ask you questions, what is it that you do as a dietitian? That's really great practice, actually, talking to them. And you can kind of see, what message goes across well, what message settles well with them, what kind of things are they interested in, what do they want to know. And it's going to be similar things that, the legislator might want to know, but just keep those things in mind. Good practice before. So stay posted. We don't have a date yet for Legislative Day Part 2 webinar, but we'll definitely go over a lot of logistics and information on that day so that you feel really prepared for the day. And there's a lot of dietitians that are not on the call today, but you work with a lot of them, and you can promote, are you going to Legislative Day? This is the date, we could go together. It'd be great if we, came. Just kind of encourage people to go and be there in Santa Fe, because the more of us that are there, the better our message will be. Does anyone have any other comments or questions they want to share? Okay. Well, thank you for coming today, and we will talk to you soon.
All right, thank you.
Thank you.
Thank
All
you.
right.